guys, I'm here to represent you about the following topics: the type of wounds, first aid for open wounds, types of shock, first aid for shock, animal bites, first aid for snake bites, and first aid for dog bites. Type of wounds. Wounds can be caused in a number of different ways by a variety of different objects, be it blunt, sharp, or projectile. They are classified into several categories dependent on the cause and resulting injury. These are the type of wounds: insect wounds, laceration, abrasion, puncture, avulsion, and amputation. Incised wound. A clean straight cut caused by a sharp edge tends to bleed heavily as multiple vessels may be cut directly across. Connecting structures such as ligaments and tendons may also be involved. These are the example of incised wound. Laceration. A messy-looking wound caused by a tearing or crushing force doesn't tend to bleed as much as incised wound, but often causes more damage to surrounding tissues. Accidents with knives, tools, and machinery are frequent causes of lacerations. Abrasion. A wound caused by a scraping force or friction tends not to be very deep but can often contain many foreign bodies such as dirt after a fall on loose ground. Puncture. A deep wound caused by a sharp stabbing object may appear small from the outside but may damage deep tissues, particularly dangerous on the chest, abdomen, or head where major organs are at risk. Example: avulsion. A wound caused by a tearing force in which tissue is torn away from its normal position may bleed profusely depending on the size and location. The tissue is often completely detached. Amputation. The loss of a distinct body part such as a limb, finger, toe, or ear, often very severe with profuse bleeding. In the cases of limb loss, this is a medical emergency. Example of amputation. First aid for open wounds. What is an open wound? An open wound is an injury involving an external or internal break in body tissue, usually involving the skin. Nearly everyone will experience an open wound at some point in their life. Most open wounds are minor and can be treated at home. False accidents with sharp objects and car accidents are the most common causes of open wounds. In the case of a serious accident, you should seek immediate medical care. This is especially true if there's a lot of bleeding or if bleeding lasts for more than 20 minutes. Wash your hands, control bleeding, rinse the wound, dry the wound, replace any skin flaps if possible. Cover the wound, manage pain, and seek help. Washing your hands prior to cleaning or dressing the wound. Ensure your hands are washed to prevent contamination and infection of the wound. Rinse the wound with water. Keeping the wound under running tap water will reduce the risk of infection. Wash around the wound with soap, but don't get soap in the wound. And don't use hydrogen peroxide or iodine, which can be irritating. Remove any dirt or debris with a tweezers cleaned with alcohol. See a doctor if you can't remove all debris. Dry the wound. Gently pat dry the surrounding skin with a clean pad or towel. Replace any skin flaps if possible. If there is a skin flap and it is still attached, gently reposition the skin flap back over the wounds as much as possible using a moist cotton bag or pad. Covering the wound. Apply a bandage, rolled gauze held in place with paper tape. Covering the wound keeps it clean. If the injury is just a minor scrape or scratch, leave it uncovered. Manage pain. Wounds can be painful, So consider pain relief while the wound heals. Talk to your GP about options for pain. Seek help. Contact your GP, nurse, or pharmacist as soon as possible for further treatment and advice to ensure the wound heals quickly. Types of shock. Shock is a life-threatening condition that occurs when the body is not getting enough blood flow. Lack of blood flow means the cells and organs do not get enough oxygen and nutrients to function properly. Many organs can be damaged as a result. Shock requires immediate treatment and can get worse very rapidly. As many 1 in 5 people shock will die from it. Types of shock. Cardiogenic shock due to heart problems, hypovolemic shock caused by too little blood volume, anaphylactic shock caused by allergic reaction, septic shock due to infections, neurogenic shock caused by damage to the nervous system. Cardiogenic shock. Cardiogenic shock takes place when the heart has been damaged so much that it is unable to supply enough blood to the organs of the body. The most common causes are serious heart conditions. Many of these occur during or after a heart attack. Cardiogenic shock occurs when the heart is unable to pump as much blood as the body needs. It can happen even if there hasn't been a heart attack. If one of these problems occurs and your heart function drops suddenly. Hypovolemic shock is an emergency condition in which severe blood or other fluid loss makes the heart unable to pump enough blood to the body. This type of shock can cause many organs to stop working. It caused by severe blood and fluid loss such as from traumatic bodily injury, which makes the heart unable to pump enough blood to the body, or severe anemia where there is not enough blood to carry oxygen through the body. Losing about 1/5 or more of the normal amount of blood in your body causes hypovolemic shock. Anaphylactic shock. Anaphylaxis is a severe whole-body allergic reaction to a chemical that has become an allergen. An allergen is a substance that can cause an allergic reaction. After being exposed to a substance such as bee sting venom, the person's immune system becomes sensitized to it. When the person is exposed to that allergen again, an allergic reaction may occur. Anaphylaxis happens quickly after the exposure. The condition is severe and involves the whole body. Septic shock. Septic shock is a life-threatening condition that happens when your blood pressure drops to a dangerously low level after an infection. Any type of bacteria can cause the infection. Fungi such as candida and viruses can also be a cause, although this is rare. At first, the infection can lead to a reaction called sepsis. Septic shock occurs most often in the very old and the very young. It may also occur in people with weakened immune systems. Any type of bacteria can cause septic shock. Fungi and rarely viruses may also cause the condition. Toxins released by the bacteria or fungi may cause tissue damage. This may lead to low blood pressure and poor organ function. Some researchers think that blood clots in small arteries cause the lack of blood flow and poor organ function. Neurogenic shock is a combination of both primary and secondary injuries that lead to loss of sympathetic tone and those unopposed parasympathetic response driven by the vagus nerve. Consequently, patients suffer from stability in blood pressure, heart rate, and temperature regulation. First aid shock. First thing to do is lay the person down if possible. Elevate the person's feet about 12 inches unless head, neck, or back is injured or you suspect broken hip or leg bones. Do not raise the person's head. Turn the person on the side if they are vomiting or bleeding from the mouth. Second thing to do is begin CPR if necessary. If the person is not breathing or breathing seems dangerously weak, for a child, start CPR for children. For an adult, start adult CPR. Continue CPR until arrives or the person wakes up. Third thing to do, that treat obvious injuries. Fourth thing to do is to keep person warm and comfortable. Loosen restrictive clothing. Cover with a coat or blanket. Keep the person still. Do not move the person unless there is a danger. Reassure the person and do not give anything to eat or drink. And lastly, follow. And at the hospital, the person will be given oxygen and intravenous fluids. Blood test, urine test, heart test, and X-rays and or CT scans may be done. Other treatment will be depend on the case of shock, cause of shock, animal bites. Cut teeth can cause deep puncture wounds that are hard to clean. Since the teeth are sharp, a wound can be deep yet small, making it easier for it to heal over this can trap bacteria inside the wound. Dog bites. Even the gentlest dog can bite if injured, scared, or overexcited, and all the breeds have the potential to bite. Most of the time, a person is bitten by a dog they know. Bites by wild animals. In rare cases, bites from wild animals like bats, raccoons, foxes, skunks, and wild dogs can cause rabies infections. Rabies is a life-threatening viral disease. Seek medical attention for any wild animal bite that breaks the skin's surface. Also seek medical attention if a bat is found in a room you were sleeping in. Even if you do not see visible bites, you should clean all animal bites thoroughly and watch them closely. Seek medical attention if symptoms of an infection develop. First aid for snake bites. First aid treatment is carried out immediately or very soon after the bite before the patient reaches a dispensary or hospital. First aid for snake bites. If a venomous snake bites, you call 911 or your local emergency number immediately, especially if the bitten area changes color, begins to swell or is painful. If possible, take these steps while waiting for medical help. Move the beyond snake striking distance. Remain still and come to help slow the spread of venom. Remove jewelry and tight clothing before you start to swell. Position yourself, if possible, so that the bite is at or below the level of your heart. Clean the wound with soap and water. Cover it with a clean, dry dressing. Don'ts. Do not make the patient tired. Do not use ice pack on the bite marks. Do not puncture or pinch or scrape the bitten area. Do not suck in venom from the patient's open wound. Do not give medication not prescribed by the doctor. Do not elevate the wound at the same level or higher than the chest or heart area. First aid for dog bites. First aid for dog bites. Wash the wound with soap and warm water. Gently press a clean cloth over the wound to stop the flow of blood. Apply an antibacterial ointment to the wound. Cover with a sterile bandage. Watch for signs of infections. Seek help if you suspect infection or possible exposure to rabies or if the wound is severe. Once again, I'm Vince Allen Arabistano and this is my report.